Moving on now to our debate number 3. As India prepares for a possible third wave, a scientist of a government panel has predicted that infection in the third wave can hit peak between the months of October and November if COVID appropriate behavior is not followed. However, it may see half the number of cases that were recorded during the second surge. The scientist also added that COVID infection can spread faster during the third wave if any new virulent variant emerges. The loss of immunity, effects of vaccination and the possibility of a more virulent strain have all been factored in this time, which was not done while modeling the second wave of the coronavirus. Let's open this up. In fact, we have Professor Manindra Agarwal from the IIT-Kanpur and also the scientist on the government panel. Let's understand from him the conclusions that have been drawn. Good evening to you, sir. Good evening, Professor Agarwal. If you could help our viewers understand what are the parameters that were taken into account before, of course, this conclusion we arrived at that the third wave will hit peak in October, the months of October to November, and that this is going to be a little less as far as, in terms of impact if you compare it to the second surge.
Well, okay, there are some factors that one can make a reasonable guess about, and there are some factors here which we really have no idea. We just have to assume that something may happen. The factor which we can estimate reasonably well are two. One is there are some people who get infected, recover, but then lose immunity after some time. And there have been studies which talk about something between 10 to 20% of people lose immunity. So that's a factor we can estimate well. Then we also have the vaccination schedule given by the Government of India, monthly one, and then we can assume that people will get vaccinated at that rate, thereby inducing immunity in them. So these two are reasonably well estimated, but a factor like when or if a new mutant, which is more infectious, will strike, is one can simply make a random guess. We cannot really predict. Similarly, with respect to people, when they will abandon all the precautions and go back to their normal day-to-day life is something one can hope it doesn't happen, but if it happens, one can only make a guess of when this will happen. So some of these guesses are involved, which we have made at we've essentially created three scenarios. One in which people drop all the safety measures by August end. And another scenario was when by August end, in addition, a 25% more infectious mutant also strikes. And the third scenario was assuming that vaccination is a little less effective than what we had earlier assumed. So these are the three scenarios which we constructed. And it turns out that from two of the scenarios, that is, which doesn't involve a new mutant, the third wave is merely a ripple. It hardly adds anything, but when a new mutant strikes, it would be somewhat larger.
All right. So the bottom line is that COVID appropriate behavior can help us sail through the third wave whenever it hits us. We don't know when that is going to happen, but like you said, if people don't follow COVID appropriate behavior, then it might hit us sooner than expected. Thank you very much, Professor Agarwal, for joining us on the broadcast, for taking those questions and providing our viewers the much needed clarity on the situation.